one of the main reasons a mom doesn't have good breast milk supply is a low thyroid. And unfortunately, the way we test thyroids in the US doesn't really catch a lot of low thyroids in breastfeeding moms, pregnant moms, postpartum moms, because the main marker that's used, TSH, which is called thyroid stimulating hormone, will look hyperthyroid. So the number will be very low because of the other hormones, particularly prolactin when a mom's breastfeeding. I don't even like to measure thyroid stimulating hormone on my mamas. I like to only do free T4 and free T3 because free T3 is what is the active thyroid hormone in the body. And the thyroid itself is the gland in your neck that regulates the rate of metabolism of every single cell of your body. So when that thyroid is low, every single cell runs slowly. So it can lead to everything from depression and fatigue to constipation, dry skin, hair falling out, weight gain, not able to lose weight, being cold, not thermoregulating well. And honestly, when it happened to me after my third baby, because 1 in 20 women will develop a low thyroid just by being pregnant, and that's what we know in mainstream medicine, so it's probably much more. But what I felt after my third was it just felt like pushing a river to get through the day. It's really tough postpartum, and especially if you have a baby that isn't sleeping very much, to differentiate what could be thyroid and what could just be normal postpartum. However, you can test it. And we have a postpartum blood panel on our website that even when you have something like Kaiser, you can use. And it's very affordable. But even if you can just get a doctor to order that free T4, free T3, and then really look for a vital range for that. So you want free T4, you want 1.4 or above, and free T3, you want 3.3 or above. It's nice because there aren't very many things in our health that we can objectively measure. So if we can measure that, it's just a really nice. And then if you are low, thyroid medicine is fantastic because there's like really no side effects. If you overdose, you just feel like you've had too much caffeine and then you back off. If you take a thyroid medicine and you don't feel anything, that means you aren't dosed highly enough. Because if you take enough, you'll feel like if you take too much, you'll feel jittery. But if you don't take enough, you won't feel anything. And so I've had a lot of women too say, oh yeah, they tested me low thyroid, I took the medicine, didn't do anything, so I stopped. Well, that actually means they needed more medicine. So it's just like, ideally you would get tested right away. And then if we find something, we can ask for medicine from your mainstream doctor. And then if it's not out of lab range normal, but it's kind of questionable, we have some really great supplements, natural, really high quality supplements that work really, really well. Yeah.